So you can all hear me and you can all see the slides, yes?
Yes.
And if you want to,
Yes.
you can pin this and put the people in the corner. You can do whatever you want with your Zoom if you're familiar with it. You guys are off to the side, so I like to see all of you. If you have a question, you can put it in the chat, and I know Chelsea's going to help kind of keep track of that, but I'll leave time for questions. So, okay. So tonight we're going to talk about pelvic health in pregnancy and beyond, and pelvic health is, I'm a pelvic health specialist, but pelvic health really impacts both men and women of all ages and stages. We're going to talk about this particular stage of a woman's life, but know that pelvic health is important starting as early as when we're in our preteens. So this is me. I am what's called a urogynecologist. I'm board certified in OBGYN, although I haven't done OB in like 18 years, and female pelvic medicine and reconstructive surgery. So I deal with all things that impact pelvic health, which includes disorders of the pelvic floor, post-childbirth issues, painful intercourse, incontinence, sexual wellness, body wellness, hormones. Those are all things that I am really budding in my profession now, and I've done a lot of surgery in my my practice as well. And so I'm the owner of the Center for Pelvic Health and Wellness here in Mission Viejo on the Mission Viejo Hospital campus, but I am not technically a foundation physician. I'm independent from the hospital. So that's me. I've been in private practice for 14 years and I have 3 sons. And then we have Susan and Angie who have joined us. If you would want to do a quick rundown of this slide, Angie, feel free to do that. Or not?
Hello. Okay, I just wanted to unmute myself.
Yep.
First, just a quick note. Both of us are wearing masks. First of all, because we are together, but I am wearing what is called a communicator mask for Susan's sake, because Susan is hearing impaired and she only reads lips. So in order to wear a mask, I have to have it with a window so that she can see my lips. It's a very clever invention, thank God, all due to COVID-19. But anyhow, we are going to then introduce ourselves. So Susan, you can tell who you are.
Nice meeting everybody. I'm a physical therapist and just recently got my doctorate in physical therapy in May 2020 from Chapman. And I've been practicing for over 30 years, and I absolutely love working with patients, especially those suffering from pelvic floor impairment. And so I'm very excited to be here to help you manage and get prepared for the coming of your new baby. So if you have any questions, please feel free to ask us later at the end of the show. Thank you.
Very good. Thank you, Susan. My name is Angie Garrett. I am also a physical therapist who specializes in orthopedics and pelvic floor. I have been a therapist for almost 29 years and working pretty much almost that time here at Mission Hospital. Susan and I created this program here almost 16 years ago. And so we've been doing pelvic floor for quite some time. I am originally from South America, Ecuador, South America to be exact. And I hold degrees from Michigan, Illinois, and California. And the most recent one, the doctoral degree in physical therapy, which we actually did together, Susan and I. So again, we are happy to collaborate and be together here with Dr. Wallace to give you our little pearls of knowledge to help you ride the storm of pregnancy and post-pregnancy in the most gracious way and happy way. So welcome to everybody.
Great, thank you so much. Now the objectives of this talk are going to be here listed on this slide. We're going to describe the body changes in late pregnancy, briefly touching upon the physical changes, hormonal changes, some of the urinary tract changes that you may have already experienced or that I could give a little bit of information about, and then some intimacy things. The 4th trimester is the days 1 through 90 after childbirth, and they talk a lot about that when it comes to infants, but really women also go through a significant amount of change in the first 90 days after childbirth. And then we'll talk about the 5th trimester, which is after 90 days, settling into routine. What happens to your body after those months? So in late pregnancy, what's happening to me? Well, all of you are in late pregnancy and or have had children on the call. And so we're going to go through each of these things and just touch upon them. So physical changes. This is me pregnant with my third child. I don't mind showing it. These children at the end you'll see are 19, 17, and 12. So this is my third boy in here. But what's amazing is that, all of the changes that happen to our bodies, they are beautiful, they're meant to happen, but they are also disturbing sometimes. And we sometimes are concerned that, am I ever going to be the same? And you may not be exactly the same, but you're going to have the ability with some knowledge to be able to get yourself back to where you'd like to be. As estrogen increases in pregnancy, the breast size increases, and we have changes in the labia and genitals, and that is responsible for the sensation of heaviness, veins, engorgement, increased sensitivity. So there's some good things and some not so great things that happen when we get increase in those types of areas. Progesterone goes up high, and it's produced by the placenta, which contributes directly to swelling, pooling of the fluid in the legs, as well as varicose veins. And unfortunately, varicose veins is somewhat hereditary. And I didn't know that until I had to have one of my legs completely worked on by, and I have a great vein doctor, by the way. But once you have fairly big varicose veins, there's something that's due to progesterone in pregnancy, unfortunately, and that makes it worse. Our gut slows down for two reasons. One from progesterone. The other reason is the uterus grows and it pushes on the entire intestinal tract, pushing it out of the way and compressing it down into the pelvis. We get laxity in our joints and ligaments, so we actually may feel that we are able to stretch more. We are also slightly increased risk of injury if we do something wrong, but that laxity serves a purpose in allowing the pelvic bones to separate and to be open so that the birth canal and the infant can pass through the bony pelvis, really. Urinary stasis means that the urine in our bladder coming from the kidneys all the way down does not move as easily through those tubes. And so we're at slight increased risk of bladder infections during pregnancy if we haven't had that. We also have a risk of bladder frequency, not risk. We go more often because things are pushing on our bladder. And we can leak a little because there's a very heavy pressure pushing down on the pelvic floor. And then late in pregnancy, we get the increase of prolactin, which causes milk production in the breast, getting us ready to nurse. This is a much more complicated slide looking at all the systems that are impacted by pregnancy. And if you just take a look around here, nutrition, average weight gain, respiratory system is affected, lungs, breasts, gastrointestinal, we talked about, vagina, skin, we get dark pigmentation, spider veins, all the fun things that we think about. Musculoskeletal, because of the weight of the forward uterus, we tend to have a sway back, and sometimes women have different ways of walking. You see women waddling around because things are heavy between the legs. Cardiovascularly, we are sort of these miracle sort of bodies. Our blood volume increases significantly, and our heart rate goes up, our heart enlarges. These are all things that prepare us for childbirth, but also allow us to, when we do lose blood at delivery, which is natural, that we don't end up significantly anemic. So it's kind of, again, amazing. Urinary renal, we talked about that, and then the uterus being large. Endocrine gland, endocrine means gland. So your brain, your thyroid, your placenta, and the baby all interact in this very balanced hormonal interconnection to keep things where they should be. And so it's kind of amazing that we even get through it at all, but it's perfectly designed. And when we talk about pregnancy and sex, the first thing, of course, is that, and I'm big on really trying to have couples reconnect or stay connected if they can. Your provider will give you any restrictions, but most of the time, pregnancy should be a very natural state where you get to exercise and do whatever you want within the realm of not being able to hurt yourself. So your body changes are natural and beautiful. In pregnancy, especially in late pregnancy, the most comfortable position for women is often side lay position with partner from behind. And that can be a really pleasurable position even later on in life. So if you've never tried that, that's a good one because there's not a lot of stuff in the way. You are very increased sensitivity. And so orgasm can be really accessible in pregnancy. and it's a whole nother talk, but I have been educating women a lot about their access to their pleasure, and just going to throw it out there that, you know, as women, we're kind of maybe taught that our partner's responsible for our orgasm, but in reality, you kind of need to find it on your own and then tell your partner how you can be pleasured and or take control of that during your lovemaking, and make it sort of a way for you to be able to be open and comfortable and intimate, which is being able to, you know, sort of share those most inner sort of secrets with our partner, if you will. Pain is not normal. So if you have pain, you want to back off whatever you are doing. And again, sex does not just mean intercourse, because there's many ways that we can be sexual with our partners. Kissing, touching, foreplay, those are all really important ways to stay connected. Intercourse is just one piece of sex that we think of and we sort of label with that term. But sex can be anything from even just, you know, talking, holding hands, and touching. So just keep that in mind if there are some restrictions, or postpartum when you want to be close to partner, yet maybe perhaps you can't have a full intercourse session. After birth, and we'll get into a little bit what happens after birth, there's a lot of changes that happen within the first 6 weeks, and they're very dependent on whether or not you have a vaginal delivery or a C-section. In general, the uterus shrinks back down pretty quickly within the first 6 weeks. And so we can have significant cramping. That's when we have the most laxity in our abdominal walls. And we still, when we walk out of the hospital, look like we have, like, you know, a 4-month pregnancy in there. But technically, it's really just the uterus that's enlarged. And the pelvic changes that result are resulting from the hormonal changes that I mentioned before. And depending on the type of birth that you had, if it was a prolonged delivery, if it was an easy delivery, if there was a lot of pushing, if you had a lot of swelling, if there was a tear, and so on. So if we look at the pelvic floor from below, so this is looking at, I'm going to get my pelvis. I forgot to grab it. One second. I know the therapists have a pelvis too. So, oops, my video's off. Hold on. I'm going to show you if you want to look here. Okay, pelvis. So you can look at that. The bottom of the pelvis. My pelvis has fallen out. But basically, we're looking, this picture is basically looking straight on between the pubic bones and the tailbone. So if I'm looking up at the pelvis, you can see that this is the female and this is the male. And we have all the same muscles. The only thing that's different, which I think is so fascinating, and most people don't know this, is that here running along the base of the penis are the bulbocavernosus muscles, and they're fused together in the man. And in women, they're separated and in our labia majora. So it's essentially closed or opened. And other than that, it's very much the same. And I think it's just an amazing, amazing picture to sort of point that out. Obviously, we have a vaginal opening. This is the urethra. This is the clitoral area. But the clitoris also drops down behind here. So it is shaped like a V. That's why you can access it from inside. And then in men, theirs is just running up the base or the shaft of the penis. This whole triangular diaphragm is the bowl that supports the pelvis. And it's made up of all of these muscles. And so these are the muscles we talk about when we say do a pelvic contraction, or can you Kegel, or can you squeeze. And we'll get a little bit more about how to do some basic breathing and contracting in the second half of the talk. But I want you to realize that men and women both have a pelvic floor. So we talked about the bony anatomy and the muscle. The muscle serves a function to give support and also keep all the bones together. And the pelvic floor itself is part of your core. Your core is actually made up of your abdominal wall, which is mostly only what people think about, your long back muscles, your pelvic floor, right, and your glutes. That's your core. So it's actually the base of your trunk, and it stabilizes that. When we look at this picture, this is a different picture. Now we're looking down. If you took your eyeballs and looked down to your belly button into your pelvis, That's the view that you're looking at now. So if you look down and you look and you scoop everything out. So you're looking at the top of the urethra, the bladder's cut off, the vagina is squished, the rectum, and then we're looking into the pelvic muscles on this side from the opposite. And then if you take them away, the intricate amount of nerves and tendons that hold, ligaments that hold the bony pelvis together. This same picture is what it looks like with a head sitting in the vagina. So this little triangle here, this little rectangle, excuse me, this flat tube is your vagina, which is squished. As we sit in our chair right now, it is completely flat. This is the baby's head sitting in the vagina. So you can see that because of that hormonal increase, the vagina has the ability to stretch. And it's stretched in the pelvis as well as it exits out of the pelvis. This is a similar view of, the vagina here. Now we're looking straight on, and then the head sitting there. So again, we are designed for this, and it is pretty amazing that our bodies are able to accommodate these changes. So immediately postpartum, what you'll see is that the breasts will start to engorge and the uterus shrinks. And we still have a little bit of swelling, but it starts to reduce because our progesterone drops once the placenta is no longer in place. And so we end up with actually a very low estrogen, low progesterone state. There can be pelvic pressure, and we can have some urinary leakage because things might be fatigued. The muscles may have underwent a little bit of trauma, depending on the size of the baby or how long you pushed. There's weight loss, and then the diastasis, which is the separation in the abdominal muscles, which is very common as the uterus grows out and the abdominal wall accommodates that, reduces, and not everyone has it go completely back down. And then joints and posture change as you begin to gain back a little bit of your awareness that you don't have a large weight pulling you forward. This is where Susan and Angie are going to give us tips now, so you are prepared and how you're going to be able to get back to a normal posture sooner. And I would love for you to always have that going forward in your life. Sex drive drops because of many things. One, we're nursing. There's an increase in that prolactin, which is a natural suppressant, and our estrogen and our progesterone go down, and that also suppresses our spontaneous interest in sex. And then there can be mood changes as well. Following a vaginal delivery, the healing of the soft tissues can sometimes be 6 weeks or a little longer if there is any stitches that happens to need to be placed during delivery. And then if there's a larger tear, often you're going to having much more healing even after 12 weeks, which is about 3 months. Following a C-section, you have different restrictions. Typically, if you haven't pushed, then the vaginal area feels fine, but then we have an incision to deal with, and some of the things that we need to be careful with that are typically lifting heavy things, repetitive bending, and hoisting and pushing. So common couple issues at this time, really, it's all about no money, no sex, no time. So duties at home increase, fatigue is high, and there can be arguing. So some things to keep in mind right now is that practice saying thank you if that's not something that you do already. Lighten up and accept help. Don't worry about the fact that the bed's not made perhaps, or that there might be a few dishes, because these are things that you're going to navigate from this moment on, not just as a couple, but as 3 people, and then if you have more children or extended family that are with you. Also know that parenting styles may differ, and I don't know how much couples talk about their parenting styles before, but I will tell you that being flexible in your parenting style and how you approach parenting your children will be helpful for you. As an example, I actually had a very different parenting style than my husband, having been raised in a large family and him by a single mother. we raised 2 kids, and then our third son, which is 5 years after my middle son, was diagnosed with autism at the age of 2.5. And let me just tell you, everything you knew about parenting got thrown out the window, and then we had to become different parents. And I wish I knew all that when I parented my other children, because it was actually a much easier way to train a 2 and 3-year-old. But those are things that you don't really know. So I would just say be flexible, be open, talk about it. Sleep, food, and discipline are probably the most important things, and early on, sleep and food, so that you're not having arguments about your philosophy on attachment parenting versus sleeping in the bed versus sleeping in the crib versus sleeping in the other room. No me free time. I think it's really important, and this is something I've mastered now in my life at 52, to make time for myself. The more time that you allow yourself just a little bit of private time now, it'll be locked in as a habit, and you will protect that time. And I will tell you that it will be helpful for your loved ones and your children if you are more balanced and not completely exhausted as a result of giving 100% of the time and not ever getting a little bit of self-care back. Grandparents, Angie can share some things about this, but when your parents come to visit, it may be nice or it may be stressful, and we all want our parents to be around our children or to help us, but it's important to establish boundaries if you can early on, so that you are feeling like you have the control of your household. And some people don't need that, but others do need to know that they're the ones who are making the decisions and running the show and creating schedules and so on and so forth. And then finances, kind of setting a budget and goals early is helpful if you can do that, so that you are not surprised by how expensive it may or may not be to raise a child. So intimacy should be established early, as I talked about, hopefully before delivery, but knowing that couple cuddle time, kissing and hand holding is a really good way to stay connected, and then establish your routines. Once those are established, after you're in that survival mode for the first 6 to 12 weeks, you're going to be able to free up some time perhaps to have date nights, maybe nap together, make sure that you don't underrate the quickie to stay connected, and then maybe exercise together, because that is a positive release of endorphins. You're also feeling good about your body when you exercise. It releases stress and it helps you sleep better. So I would say that, incorporating just a small amount of exercise every day, whatever it may be, can really be a good habit for a couple. It might be the time when mom or dad want to be separate so that they can have their alone time, and then they exercise separately and it's your turn versus my turn. But, we've all had to adapt in the last 2 years of being home and doing more of our own workouts. So hopefully you've been able to access YouTube, which has a million different exercise routines, whether it's yoga and weights or walking or, even like boot camps. So I think there's not really much of an excuse to not exercise. I think it just has to become part of a habit. After the first 6 weeks, we continue to have changes in our hormones. And so we might start to see in the pelvic area some dryness in the vaginal area. And this is because the estrogen is really at an all-time low, because especially if we're nursing. If we're not nursing, we're going to have a little bit more return to normal hormone levels sooner than if we are nursing. And there are ways to remedy that. Certainly when you have your 6-week checkup with your OBGYN or your midwife or your provider, hopefully they're going to talk about it. But some don't give you a lot of information. And so if you have questions, that's a good time to ask. If they go, okay, go forth and have sex with your partner and we'll see you in a year, and you're having pain for 4 months after that, I highly encourage you to not let that be the case. But there are things that you can do right off the bat. Don't underestimate lube. The lubes that I like are coconut oil and or silicone lubes, because they don't dry up. I know everybody wants to use a water-based natural lube, but they dry up so quickly and they get kind of gunky. So I would say that, if you want to watch my lube on Instagram, I have a whole lube video and it's hilarious, but it talks about a lot of the different lubes. And then how do we restore vaginal health if we feel that we've had a large tear, or that things are relaxed, or if we're having some urinary leakage, then that's something that there are layers to that. One, be patient, because when you stop nursing, things often get significantly better. But two, right away working on the strength of your core and your pelvic floor, which we'll get a little bit of an exercise lesson here in a little bit. And then three, there are doctors like myself who can help restore pelvic health, not just surgically, but through other things that are really out of the wellness arena, including gentle heat, magnetic chairs, all sorts of things to bring things kind of back together. All right, so we're going to move into body mechanics now. And this body mechanics, I'm going to have physical therapy take over, and they're going to take you through these 4 sections: standing posture, sitting postures, diaphragmatic breathing, and pelvic floor exercise. And this is where I want everybody to participate. So if you want to turn on your videos so that we can stand up and move around, it's helpful because normally we're in a classroom together and we're all kind of slouching and moving together. So it's kind of fun if you want to do it. If not, you can leave your videos off. Okay, so I'm going to hand it over to Angie and Susan, and I'll just control the slides, I think, for you guys.
All right, so I unmuted. Can you hear me, everybody? Yeah?
Yep.
Yes.
Okay.
Yes, we can hear you.
Everybody could hear. All right, so the first slide, as you can see, we're going to talk about standing posture. It's so important for us to understand how our body works, all right? And so everything is integrated, everything works together. So if we incur incorrect postures, it's going to put a lot of abnormal forces on not only that body part, but other body parts. And your body right now, whether you're pregnant or after pregnancy, is adjusting so much because of the hormone changes that you must be really in tune with your body in order to adapt and in order to modify your postures to avoid injuries that can later, after you've recovered from your pregnancy, you may start feeling. But if those do develop, because that can happen, you can always talk to your physician so they can refer you to physical therapy, and we can help you then restore those motions that have gone astray during the pregnancy or right after. So in this slide, what it's talking to you is about the ideal posture compared to the posture that sometimes we assume due to the activities that we're doing. So for example, if you slouch, I'm gonna move the screen a little bit more back here. So slouching, as you can see, in that, let's see, the kyphotic posture or the second, the sway back posture, it puts a lot of pressure. The belly is in front, you hang out with your belly. And so now you are relying on your ligaments more so than your joints and your muscles. Not only that, but with your shoulders forward, it puts a lot of strain on your neck, and that will be your cervical spine. So if you start having neck pain or shoulder pain, even headaches, it could be due to the posture of the rest of your body, not so much only stress. Next slide, please. So again, more specific to the duties that you're going to be having with the new baby and the new addition into your life, which again, I congratulate all of you, whether it's before or after. I see some of you already have some babies around the house, so you're busy people. I have 3 grandchildren, ages 5, 3, and almost 1 year old, and I have 2 children. And so I've gone through these and I've learned the hard way, perhaps, but now I have the blessing of the knowledge from physical therapy that I can also pass on to my daughter, to my grandchildren, and to you now. So in this case, for example, just a simple activity of holding the baby, right? How much do we love them? We hold them. But you can see that in the first picture, the mom is again hanging out on her ligaments of the lumbar and hip joints. That can put a lot of strain on your back. So think about a plumb line. You see the dotted line coming down through her body on the second picture. Think of the plumb line. Shoulders, hips, knees should be lined up through the joint, and then the plumb line should fall right slightly in front of your joints, kind of where your midfoot is. And then if you go up from the shoulders, it should go right through the ears. So if you line up the shoulders with the ears and hold the baby, you can do still the same things that you do, but not strain your back.
Angie, can you scoot back? We can still hear you, but I'd rather them be able to see your body more. Even more so. Like, so have Susan fix it while you move back. Yeah. There you go.
So,
Yeah.
Yeah, so this would be correct.
And just speak loud.
And then this would be correct. One way to correct the posture is if you try to stand or have your body weight fall slightly more towards your heels, not all the way, more towards your heels, and line up the bones of your pelvis. Remember, Dr. Wallace showed you that bones of your pelvis with your pubic bone. They should be in the same plane, the same line, so that if your pubis is in front of your ASIS, which is your iliac crest, it's incorrect. But if your iliac crest is right in the same plane as your pubis, you have effectively put your body more in the correct position. Go ahead and take the next slide, please. Okay, so again, body mechanics of lifting, right? Mostly we're going to talk about babies and of course your other things that you may be having to do at home. In this case, obviously, trying to do too many things all at once, I do not recommend. This whole thing about multitasking has been overrated. Um, I've learned that multitasking also makes us not very effective in all the things that you do. You may be able to do a lot of things, but maybe not all the things that you do at the same time are accomplished in a good way, or at least not in the best way possible. So focus on what you want to do. Maybe you need to take a couple of trips to the car to get the groceries and the baby, do the baby first and then get the groceries instead of doing all at once. But these moments do happen. Go ahead and next slide, please. All right. So now we're going to look at lifting the baby. Incorrect postures would be bending over with your back, keeping the baby away from you. Correct posture means what is shown on the left side, which is making an angle between your back and your hips so that your back stays straight, fairly straight, maintaining your curvatures, but you really hinge at your hips. And then you bend your knees so that you get that nice sitting position almost. So the baby should be close to you. So if the baby's moving, have the baby crawl to you or move to you, or if the baby's not crawling yet, you move to the baby. And then you get into this sitting position, which is also, it could be a squatting position if you open your legs a little bit. So if you squat and sit back, and I do recommend, now that your ligaments are nice and loose, that you practice squatting. Squatting is the best position for your pelvic floor, for your back, for your hips. So if at the age of 62, like me, or Dr. Wallace, for wonderful flexibility, you're able to sit on the ground with a squatted position, do things while you're in this position, you are doing a great favor to all of the joints of your back. This also could be a position for playing with the baby, and definitely the best position for lifting the baby. From here, bring the baby to you, grab the baby, secure the baby, and then unfold your joints all the way up to standing position. All right, next slide, please. I just demonstrated what is shown on the left side of this slide. Now, if you're changing the baby, of course, now you are having your changing tables, your baby room, etc. As you can see on the left side of the second picture, bending forward on your back, not so good, right? So you want to, if the changing table is low because you are tall, again, hinge at your hips, do that little squatting position. And in order to maintain that position, lean into that changing table with your knees so that you support that position and do the changing of the diaper. I have a card here that, let's see if we can move it back a little bit. But the most ideal position, of course, would be, again, maintaining that nice tall standing posture close to the changing table. You do not bend at your hips, but you maintain that upright posture. You have to bend over, bend your knees, Do not bend your back. I hope that makes sense. Next slide, please. All right. Going back to the squatting position, I just demonstrated that. And the half kneeling is also super, super helpful. Instead of bending with both knees straight, which is horrible for your back and can actually throw your discs out, put one leg in front of you, and preferably the leg that you are stronger with, that you feel that it's a stronger leg. Bring it forward if baby's on the floor, let's say, or stagger your legs, and then kneel on one knee. Again, bring the baby close to you, secure the baby first, and then stand up. Now, if you need to support yourself because you're sore or because you're weak, I'll stay with you, but then again, move towards or have a table or a chair near you so that you can use the other hand to push on it. I've tried all of these things with my grandchildren now. I don't know if I did this with my children, but I'm doing this with my grandchildren because obviously I am much older and they all work really well in many different scenarios. So I recommend developing the habit, because at first, you're going to do something that you're familiar with. All of us do. But the goal here is to change the habits that you use in order to improve the ability to use your body and save your body so that later in life you have also a good, gracious aging process. Next slide, please. Okay, so here you have more dynamic movements that you might want to enjoy. Of course, eventually you're going to go out with the stroller with your baby. You might want to jog with your baby, etc. So, and we want you to do that, right? So, as you can see on the slide on the left, what we want you to do is maintain that relaxed posture in your shoulders. What you don't want to do is to shrug your shoulders and tense up your neck. None of this, none of this, none of this. And this happens especially when you go up hills or down hills. When you go uphill, if it's a steep hill, you're going to do this. Your chin is out, your head is forward, your shoulders are up. So what you want to always do is relax the shoulders, bring that chin down, bring your elbows in, and push as a unit with your whole body, as opposed to just with your arms. That's where the tension will come on if you do it incorrectly. Push with your whole body. If you're going downhill, bend your knees a little bit, stay close to the stroller, and push with your whole body as a unit. Same thing if you have to pull, let's say you get the grocery cart at Costco and the grocery cart is full of groceries and it's heavy. You want to pull with your body as a unit as opposed to just with your arms. I don't know if you can see me, but rounded back is not good. Straight back, bend knees, close to the stroller, and push with your whole body is correct. If you have any questions, by any means, interrupt me, okay? Go ahead and next slide. All right, so here's a little acronym for you to remember, the WASH acronym, because it refers to how the wrists, the abdominal muscles, the shoulders, and the hips should be in position in relationship to what you're pushing or pulling, in this case, the stroller. I already addressed the fact that the shoulders need to be relaxed, the hips need to be slightly bent, abdominals need to be slightly engaged, because obviously if you're going to push with your whole body, you're going to engage the abdominals. Otherwise, you're going to push with your back, and that's going to hurt your back. So keep the abdominals engaged, tucked in. Think of also the tailbone tucked under you a little bit. It shouldn't be all the way because then you'll have a rounded back. You don't want that either. So it's kind of in the middle, right? Middle of the ground. Always moderation applies here too. And then the wrists, instead of being flexed or too extended, they should be fairly neutral. That means in line with the stroller. So you may need to adjust the height of the stroller if it's possible, but a lot of the times is due to the position of your shoulders. So if you adjust your shoulders, your wrist should be in the most optimal position. Next slide, please. All right. So a few other things that can be frustrating, especially for first-time moms, or even for moms who have now multiple children, getting them in and out of the car seat. You've been doing this now for maybe 2 or 3 years, 5 years, depending on how many kids you have. And it gets tiring, especially as the kids grow older, they get heavier. So the one thing you want to remember is not to put the baby inside the stroller with your back again bent over and straight on. You want to try to be sideways, if at all possible, so that you can put the baby in or out of the stroller. And that way, you can either bend your knees as you do so to maintain that proper body mechanics. You can also keep the baby closer to you, and that mechanical advantage that you're going to have by doing that. And the other opportunity you have by doing sideline is that you can have the closest leg to the car seat, bend it and put it maybe rested on the car seat. If not, even putting the foot inside the car seat and then putting the baby in the car is going to give you, it's going to make you feel like the baby actually weighs less than he or she actually does. So that's one technique. And the other technique shown on the far left is simply bending both knees and then putting the baby in the car. But the worst thing you can do is face in the door in the car seat and go straight forward. That is going to hurt your back because both knees again are on the ground and both knees are straight. And therefore that forces all the pressure, all the effort on the back muscles and the back, on the spine disc as well. Okay, next slide. This is another common frustration or common problem where the bathing of the baby. One last previous, there you go. The bathing of the baby. So pretend this is the bathtub is here. A lot of people have done it like this, or just they kneel, both knees on the ground, seems natural, and then you lean over to bathe baby. It's going to put a lot of pressure on your back. So a couple of techniques that you should maybe alternate while you're doing this activity is having one leg up and perhaps up against the bathtub while you then, reach for the baby. That allows you to maintain your back nice and straight. And if this gets tiring, then you change and do the other leg. Do the same thing. As you can see, my back tends to be straight. But if I do this and lean over, inevitably I'm going to have to bend my back, and it's not going to be good. The other one, of course, is if you have good flexibility and strength, is to have that double squatted position that I mentioned earlier. It's a little bit challenging if you haven't developed this flexibility yet. But I would recommend that you work on this just plain squatting and then later apply it to bathing the baby. It's a little more challenging. Any questions so far? Or any concerns or problems? All right, so now I'm going to hand it over to Susan. She's going to talk to you about sitting postures and sitting issues that may come up during this period. Hi.
Hello there.
Talk along. Talk.
Hi. So I'm going to talk about sitting. As you can see, there's a wide variety of sitting posture. So which one is right? And I think for most of you, you can say that doesn't look quite ideal. Well, let me give you the basics. So we're going to have a chair here. I'm going to turn it sideways. And just to show you that the things that you want to look for is to pay attention to the pelvis. The pelvis can help you identify if you're sitting ideally. So I'm going to use the model that Dr. Wallace showed earlier, and I'm going to turn it sideways. Ideally, if I were to step aside, ideally, it would be what we call neutral. So very quickly, you can see what happens when you slouch and you sit on your tailbone. That causes the round back. That can put a lot of strain on the low back, as well as cause your forward head, potentially cause your neck pain, shoulder pain, back pain, as well as affecting your pelvic health. So to help you identify ideal posture or alignment, you can do what we call the pelvic rock. You can go slouch And then you roll your pelvis forward, forward, forward. Yeah, eventually you can go comfortably. And just do a couple times just to get to know your low back. And then you find a halfway point. And that generally is like the foundation for your spine. So I will demonstrate with myself. So I will first put my hand on my pelvis, like on the pelvis model. And I'm going to slouch. If all of you out there sitting, try it. Put your hands right over your pelvis. We all have pelvis. You may not feel as much because you're pregnant. But just try it. Just try to slouch and you see how it affects your posture. And my head kind of goes forward. And my chin roll forward. And then after you roll your pelvis forward, then you kind of have a sway back. And potentially for some people, they just like that. And that can contribute to low back pain. So the idea is to find this neutral alignment. And that kind of sets the stage for an ideal posture. So if you can move to the next slide, Dr. Wallace, please. Thank you. So you can see this person going through a variety of possible changes from slouch city, way forward, and neutral. The second thing you want to pay attention is your feet alignment. Notice in the second slide to the left, this lady is cross-legged. So what happens with that is it's kind of like a good analogy is like a table. The table has 4 legs. A table is evenly distributed on all 4 points. That's what creates foundation for your pelvis and your spine. So having said that, you will want some weight on your feet. So, and you will want to have a slight forward lean to distribute your body weight to your 1 to 2 feet. So that's kind of how you can identify what's your best posture. Be aware that not all chairs are created alike. So in my chair right now, it kind of has a slight tilt. And I'm sitting unsupported. So potentially, with gravity, after a few minutes of sitting, I will eventually slouch. That's just what gravity does to us. And we all go through that. So if you know you're going to be sitting for any length of time, it's best to sit with a good back support. And I'm going to step the chair forward and sit right back. And if there's still a gap, that's where a pillow comes in. Well, some people have adjustable chairs, and Angie's going to put a pillow behind my back to fill in the gap. And that's what you can do yourself. So take a look at your chair again. A high chair is best. It gives you the best foundation. A couch, on the other hand, gives you no support. It just basically you're going to kind of sink in, and it kind of feels good for the first few minutes. Slouch in the chair, but for any length of time, you get sore. And it's not unlike feeling this, where you were to bend your finger for the first few minutes and feel okay. But if you were just to hang on to your finger for a few minutes longer, it does get sore. That's what happens to your neck and back and shoulder. It's accumulative. So that thing is to sit up straight with good back support. Okay, so now let's move on to the next slide, please. So here is an ideal posture for holding a baby, for nursing. So I have a baby here, and you keep the baby close. I think you say close to your chest. Quite often, sometimes the feet is quite meeting the ground. So it's okay to use a footstool or a book, a telephone book in this case. Very commonly, with the weight of the baby, the small, but like I say, gravity, it will cause you to eventually slouch over time. So quite usually a lot of women come in with neck pain, back pain. So our recommendation is to prop the baby up under the baby and bring the baby to you, not come down to the baby. So allow yourself to prop a pillow or two and bring the baby up to you, and you will feel better. The next slide, please. Okay, thank you. Okay, diaphragmatic breathing is a type of breathing that is very helpful to optimize your belly and pelvic floor strength. The It's what diaphragmatic breathing does. It helps you allow the pelvic floor, which is at the base of your spine. The abdomen is in the front, the pelvic floor is right here. And when you breathe well, it affects your spine health and your pelvic health. It also promotes whole body relaxation as well as optimize pelvic health, specifically bladder urgency and even leakage. So when we do diaphragmatic breathing, how we do this is if you can put two hands on one hand on your chest, and one hand on your belly, and as you inhale, you breathe in through your nose, and the belly will expand. On the exhale, kind of imagine you're blowing a bubble or a feather across the room, the belly will sink, sink, sink. Sometimes it's easier to feel it when you're on your back. You can see your belly rise. And you, again, inhale through your nose, fill your belly with air. And on the exhale, it's also known as belly breathing. At the same time, when your belly is moving, your pelvic floor muscles, believe it or not, is also moving in synchrony with the top, with the abdomen. So as your belly expands, your pelvic floor kind of bulges out a little bit. On the exhale, your belly sinks in, your pelvic floor comes down. That's what we recommend in terms of doing the Kegel, in terms of the lift. It's always on the exhale. Many people do not breathe well. They tend to be shallow breathers. So, and that's often brought upon by less than ideal posture. So if you're kind of sitting like this, you're not going to breathe as well. And it will affect your pelvic health. So again, make sure you sit straight and just give yourself a few minutes to practice breathing in through your nose, allowing your belly to expand, and let it out here slow, and your pelvic floor will be much more functional. Next slide, please. And again, as I was mentioning earlier, this is a very nice diaphragm picture of the diaphragm, which is a dome layer of muscle. And then we have a pelvic floor muscle down there, and the abdomen and the back muscle. So as you inhale, this whole foot expands like a balloon. And on the exhale, it comes back in. When you breathe well, as I mentioned, it helps with pelvic health. It also provides back stability. So for some of you with back pain, with tendency, diaphragmatic breathing can actually help your back pain come down a little bit. On the slide on the right, I'm going to come a little closer. Okay, now this picture on the left talks about how to do the correct pelvic floor contraction. As I said earlier, that when you do the pelvic floor contraction, it is on the exhale. So here we go again. So do it with me, please. As you inhale, you fill your belly with air. On the exhale, while you're kind of like blow your feather across the room, squeeze your pelvic floor on the exhale. That's the lift. What a lot of people make a mistake of is they hold their breath. And that actually has a counter negative effect. It puts pressure on the pelvic floor. And actually, you may even have a leakage. So never hold your breath. Just continue to breathe and exhale and squeeze your pelvic floor. And there's an upward lift, and it provides support for your bladder, your uterus, and even your bowels. I have people telling me the bowel movement is better just by doing the diaphragmatic breathing. That's a hint. Okay. Okay, next slide, please. And again, as I mentioned earlier, this is a review. So we know very well that by sitting well, you're going to optimize your diaphragmatic breathing, your pelvic floor mobility. And when you sit less than optimal, as I mentioned earlier, that is slouch, there's no opportunity for the diaphragm to move down as easily. And so when you try to do the pelvic floor contraction, that's not actually physical. So take a look at your posture again and just try to think about your posture when you sit and walk, as well as when you do the dynamic activities like lifting, pushing. Okay, next slide, please. I think that I'll pass it over to Angie.
All right. So in the previous slide, you noticed that there was a link. If you click on the link at your leisure, or you copy and paste that link, it will be a nice demonstration of the diaphragmatic breathing, because it's a little video, and we couldn't really get it on paper for some reason. So I invite you to look at that, and it will be a good way to review that as well. Okay, so one of the things that we also teach in physical therapy, and we discuss, is problems of incontinence, of course, and both urinary and bowel incontinence, as well as pelvic pain. So a few things that we need to remember, as you can see with Susan's presentation, we focused a lot on breathing. Breathing is very important. Another aspect that we need to pay attention to as we continue to improve the health of our bodies during and after pregnancy is fluid intake and fluid output. Fluid intake, believe it or not, is something that we evaluate with every patient and find out that most women especially do not drink enough water. And especially during pregnancy, living for two bodies, yourself and your little one. So the intake of fluid is very, very important. So this slide just gives you a little bit of a summary of what to think about. And if you have questions about this, or you think you might have a problem with this, especially if you're already having some of that leakage that Dr. Wallace talked about in the beginning, consult with your doctor, have them send you to physical therapy, and we'll go through all of this in detail. So you need to go to the restroom and not rush. You need to sit and really allow your bladder to empty completely. One of the problems that develops with rushing is incomplete voiding of the bladder, and that can actually turn into a medical condition that creates other problems. So take time to always sit and relax and breathe and let everything go, right? You need to void anywhere between 7 to 8 times per day, not 12, not 15, and not 3 or 4. So extremes on both ends are not good. So 6 to 8 times a day, 7 to 8 times a day, distributed throughout the day is what we're looking for. One of the ways that you can find out more accurately and fairly about this is if you keep a log. Dr. Wallace and us here, one of the things that we require as part of the therapy is for patients to bring in a diary, a bladder diary, so we can actually see what happens, because our memory always failed us and we always think we're doing the right thing. And when we put it on paper, we go, oh my goodness, this is totally different than I thought. So I invite you to keep that in mind and to maybe keep a log of your voidings and how well you void, what the volume of your void is. Is it a trickle? Is it a full, rush, or what is it? And you may start noticing some things, including even the color of your urine. It should be a clear yellow color. It should not be of intense odor. It should be almost odorless when you void. It should be, painless, of course. You should not have to force the urine out. It should come out as a passively normal event. So then there should be no exertion placed on emptying your bladder. Therefore, if you have 7 to 8 voidings a day, every voiding should be about 2 to 3 hours apart. So look at the interval between voidings, and that will also give you a clue. And each voiding, you're not going to measure it, but if you count in seconds, more or less, you count in seconds about, each second is about a milliliter or a cc of voiding. So it gives you an idea of the consistency. If in the morning you void 22 seconds and then you go, wow, that's a lot of urine. Well, yeah, because you were asleep. But later in the day, the numbers should even out maybe 8 or 10 or 12 seconds. But if all of a sudden you have a voiding that is 2 seconds, well, something was wrong. Or all of a sudden you have a voiding of 34 seconds, well, something happened there. So those inconsistencies is also what we look at, and we also help you decide what's going on and keep you from developing other more complicated situations. So on average, you should intake about 6 to 8 ounces of water a day. If you do physical activity or during pregnancy, we recommend a little bit more. If you're breastfeeding also, we would recommend a little bit more. So the squatting on the toilet seems like a natural thing to do, but many times it's not that natural. So if you have problems voiding either bladder or bowel, we have a couple of strategies to share with you. In my hand, I have what is called a squatty potty, and these are available now in Costco and Bed Bath & Beyond. And you can utilize this to help void either your bladder or your bowel. I am short, so many times the toilet can be high, and that's not good because if you don't have your feet planted on the ground, you don't have the mechanical advantage and the leverage for your muscles and your body to let go. So for the bladder voiding, we recommend that you sit more upright and forward a little bit. The knees definitely should be at least the same height as your hips, preferably a little higher. This is where the squatty potty can come in handy. So you can then lean forward, you can rest your arms on your knees, that's okay. But you definitely don't want to slouch, right? You need to be relaxed, but still in fairly good posture. If you're voiding your bowel, if you're emptying your bowel, then you can lean back a little bit to allow for that angle of the rectum to line up with the toilet and slightly lean to your right side. Because the ileum, the last part of your rectum is on the left side. So if you give that area a little more room, it will empty a little easier. You won't have to exert as much. So hopefully that helps. If you don't have a squatty potty, that's fine. Just use it, some other kind of stool if you can, if you want to keep one up. All right? And finally, what I'm going to share is a little taste of pelvic floor muscle training that we do. This is where that little hand towel comes in, where Dr. Wallace said that you could have in the beginning of the lecture. So if you can grab your towel, and I usually fold it in half and then in quarters, and then I make a little roll like this. All right. What you're going to do is you're going to place it in the chair, in the middle of the chair. So when you sit on it, your cheeks are on both sides of that towel. And this is also a practice of your diaphragmatic breathing that Susan talked about. So what I want you to notice is the pressure that your pelvic floor muscles are feeling right on the towel. So this towel is simply a sensory input. You to be more aware of what's happening in the pelvic floor. So if we do the diaphragmatic breathing with me, you can do it with me, please. One hand on the chest, one hand on the belly. You breathe in, therefore expanding your abdomen a little bit. And as you exhale, Susan said the pelvic floor muscles are going to lift, but you're also going to make that little effort of lifting or closing your sphincters. So you exhale through your lips, and I'm going to take my mask off so you can see the action of exhaling, which should be, we call that pursed lip breathing for a reason, because you purse your lips together, make a little hole so that it takes a little longer to exhale. So again, breathe in, belly out. Breathe out, belly in. And as you do that, the pelvic floor muscle lifts away from that towel roll, and that you should feel. You should feel that mechanical, physical motion of the muscles lifting up into your body. That's a pelvic floor muscle contraction. Those are the sphincters working for you, both rectally and urethra, the front. If you don't feel it, practice a little bit. Maybe you need to change your position. But if you still are ineffective, come to physical therapy. We need to train you. We need to train those muscles because you need to have those working in full capacity and well right after your delivery. Right? and therefore you will avoid all that incontinence that has been so commonly known as the result of pregnancy. It shouldn't be. It should be fully functional after pregnancy. All right, hopefully that was helpful. This is just a little taste of what you can learn with that. There's a million different types of exercises that we can help you so that you can develop that ability to do it and the ability to feel it. Because these muscles are internal, as you can see with the anatomy lecture that Dr. Wallace gave you. You can't feel them on the outside. You must feel it inside. And that is important for future, wellness for you. All right. And with that, I think we give it back to Dr. Wallace, I believe. And if you have any questions, we'll be here throughout the rest of the lecture.
Thank you very much, Angie and Susan. So wanted to introduce you to something called the Emsella chair, because this is a new, not new anymore, it's probably been around for 3-4 years, a new wellness device that is out there, and you may see lots of social media regarding this company called BTL or Emsculpt. Emsculpt is a magnetic treatment that gives the muscles in your body supramaximal contractions, and it can be applied to your abdominal wall, to your thighs, to your glutes, to your arms, to your calves, and it's really kind of turning into a way to reestablish your strength, takes your workout to the next level, build muscle, burn fat, tighten skin. So I'm not introducing Emsculpt to you today, but it's something that's out there, and I have actually a full M suite in my office, because my approach is you need to be strong from your core to your floor, core to floor. The pelvic floor, as I mentioned earlier, is part of your core. And as you learn the proper technique of breathing and contracting with Angie and Susan, or if you watch YouTube, I will say that 8 out of 10 women I check cannot do a proper pelvic floor contraction. It's just not something that is intuitive, and most of us think we do it right, but we actually don't. So I check every woman that walks through the door, and honestly, it's about 8 out of 10 that can't do it right, or they're not strong. So learning how to do it properly and how to breathe is very important. But the next level of that is, can you really get stronger by doing pelvic contractions? And depends on the person, but it is something that I find is difficult for women because, one, we are so distracted by everything else that we have to do, and two, most of us are not going to want to use vaginal weights or something to get the area stronger. So this device, Emsella, electromagnetic cella, meaning chair, in Latin, I believe, or Greek maybe, is a device that you sit on fully clothed, and it's a 28-minute session. And if you see, they have actually done now, this company has done over 40 scientific studies on Emsella and Emsculpt with the ability to build muscle. But what's very cool about this chair is that you sit on it fully clothed for 6 sessions is the base treatment to get baseline results. And they did MRI studies after of pelvic floors, and if someone's pelvic floor started down relaxed, that it actually elevated the pelvic floor. Also, quality of life studies, people filling out, well, did I leak before and do I leak after? Do I feel stronger? Do I have less back pain? There's now doctors prescribing this for people with back pain, because it's very hard to strengthen the pelvic floor if you're in pain. It's hard to work your abs if you're in pain. So Emsculpt for the abs, pelvic floor. So there's like a whole new realm of electromagnetic treatment, which is different than electrical stim. This gets the muscle into a much deeper contraction. So Emsella is a chair that is here, and I would pretty much say that every woman who's walking around on the planet and every man should probably have a strong pelvic floor. Where does this come in for men and women? For women, of course, we start to think about it if we leak, but I would say as a younger person, for posture, someone who's an avid exerciser, requiring balance, a gymnast, a CrossFitter, post-childbirth. For men, post-prostate surgery. If we're having a little bit of sexual dysfunction, getting the muscle stronger helps with our satisfaction when it comes to sensation, because there's more blood flow for both men and women. And in fact, they have a whole campaign for men, rise to the occasion, and these kinds of things. So you're going to all get a free session out of it to come sit on it and see how you like it. Okay, so let's move on. We're moving to the 4th trimester, And then we just have a few more slides before we get going. You have a lot of breastfeeding resources at Mission Hospital, so this is just a slide that's included. And I don't know if, Chelsea, we checked these numbers today, but I think they're all still correct. All of that information is exactly where you found this class on the Mission Providence website. In the first 90 days following delivery, there is a potential for developing some changes in your mood. And just being able to educate partners around mom to not, be worried about it, but to keep a lookout of whether it's just a mild mood change or it's something that's quite severe, because this is very important to have early intervention if a woman is identified as having postpartum depression significantly. But there is such thing as called baby blues, which is related to the hormonal changes, and then things can get much more intense with fears of sadness, anxiety, despair, and even suicidal tendencies. So this is very important if you notice that you're feeling either more so than what is average, or if a partner or a family member is identifying it, do not ignore. And so we have this purse line is actually for the lactation and breast support. These two are actually still active phone numbers. Again, you'll get copies where we have access to mood and anxiety therapists, as well as even an intensive outpatient program where one can be treated daily. So we have access to resources for psychological and psychiatric counseling for postpartum women, for pregnant women. We also have substance abuse at Laguna Beach and other things like that. So just want you to know that we have that available to you. And so don't hesitate to ask questions. Now, after the first 90 days, we kind of have established our routine. Most of the time, the baby's starting to sleep to some degree, and we are out of that survival mode and starting to figure out how we're going to navigate the first year. And so the most important thing that I can stress is self-care. Your hormones are a little bit more settled. The baby is not quite as needy usually. And so refocusing your attention on sleep and proper nutrition and hydration, your exercise, whether it's meditation or prayer, and connecting with community if you can, whether or not therapy needs to be added, and then asking for help again. So self-care, self-care, self-care. I can't emphasize it enough. I come across women all the time who are only taking care of those around them and forget about themselves. And in the end, burnout is a real thing. Returning back to work can be a kind of a difficult transition for either mother, father, or partner, whoever decides to stay home, if one does, versus return to work. There is a lot to be worked out there. So making the decision to stay home versus go back to work is one decision that is very big in the families. If they have access to one being able to stay home, of course, that would be lovely. However, most families these days don't have necessarily that ability. So knowing what you want to do for childcare before maybe the baby comes is helpful. Considering a gradual transition where you go back to work part-time. And then these are tips and tricks that most of us intuitively say, well, yeah, that makes sense. I need to be prepared beforehand so I'm not running around in the morning stressed out packing a diaper bag. But in all honesty, these are things that will save you time and stress on the front end if you just do a little bit of planning ahead of time. Maybe having smaller diaper bags all over the house, a couple in the car, having a dude bag in dad's car. These are things that are good to have, like a backpack. I just had like a backpack, and that was like, my husband's diaper bag, and he had it in his car at all times. So just be prepared. A little bit more will take the stress off of you now. Starting back midweek. So if you're going to go back to work, don't start on a Monday and you have 5 days ahead of you. Go back like on a Wednesday, just so it's like easing into a cold pool. And then if part-time is available, that would be great. Allowing the meal train and or prepping your meals ahead of time can also be helpful so that you can spend any extra time that is not given to baby for yourself, for your partner, for some quiet time, for some naps. 70% of couples experience a decline in marital satisfaction after the baby is born. And this is because attention has been shifted from 100% to partner, or however your attention is divided, to now split between 3 people. And so it's very important to try to focus on the friendship or the things you have in common with your partner, and try not to fall into conflict as much as you can, knowing that couples therapy is, available. And I'll give you a name on the next slide of a place that I really like their approach to how they help couples sort of identify their house of relationships and move forward. Again, date nights. I think a lot of couples are more prepared these days and even go to counseling before they're together. But it's not always realistic to expect your partner to be your lover, your best friend, your financial support, your cheerleader, your workout partner. I mean, we just put a lot of pressure on relationships now to be the end all. And in reality, I personally believe that the concept of the community and having, your connections outside, as well as, some of the more important ones on the inside, really helps a relationship kind of foundation. So just something to think about. Scheduling intimacy, rather than it being a chore, it could be something to look forward to. Like, all right, Wednesday is hump day. So every Wednesday, we're going to have a little date night. Assigning chores, making charts, and then encouraging each other to have self-care and friend or family or community time. So the Gottman relationship group is a sort of a philosophy towards how relationships are built. And I just thought this was a nice visual, and it talks about the pillars of a relationship being trust and commitment and building from the ground up. And this is something that takes time, especially when partners come together in many different ways. We might come together as friends, or we come together as lovers, or we come together through shared interests. And so these are not things that are naturally something that we sort of cognitively think about building upon, but trust and commitment have to be the base of the house. And then you build your love map, your fondness, turn towards instead of away, having a positive perspective, how you manage conflict and so on, and having a shared meaning or a mission statement basically for your relationship. So if you want to look them up there, it's an interesting but really practical approach to relationships. All right, let's get back to sex. So when sex hurts, 10 to 20% of women report pain, and it's not normal, but it can be transient after birth. Foreplay and position matters. So my experience is that most women are uncomfortable talking about the fact that things hurt, or are uncomfortable talking about or even knowing what feels good. And so depending on your openness, your background, there is a lot of educational material out there, whether it be YouTube or be books. But I will say that the vagina is not always ready just for straight intercourse. You kind of need to get things going and ready. And 80% of women cannot have a vaginal orgasm. Orgasm is something that is primarily clitoral. Even if it's not external stimulation and one can achieve an orgasm during penetration, it's often because of the friction of the underside of the clitoris, which is underneath the neck of the bladder, which we identify as the G-spot, but which is probably still somewhat of a clitoral orgasm. So these are things that I have lots of information to share with women about. But bottom line is, be educated about your body, what makes you feel good, and hopefully you're comfortable enough with your partner to start, exploring things if you haven't had some of those connections up until this point in your relationship. When we are breastfeeding, the tissue in the vagina can get very thin and delicate, and that's called atrophy. It's something that happens too as we transition into our postmenopausal years where we'll spend 30 years plus. And so my approach to women's health is to have easy transitions and hopefully to slow down aging and feel good as long as we can and live really strong. So your provider may recommend some hormone cream or some hyaluronic acid suppositories to help feed the skin the nutrients of the vaginal skin, because that skin is just as important as any other skin on your body, and in fact probably has a little bit more trauma associated with it than any other skin on the body. So know that there are things that can be done if you're having pain. Physical therapy not only helps with strengthening of the muscles, but some women and men end up with what's called hypertonicity. So it's sort of like the pelvic floor is clenching rather than sort of relaxed. And so it's stuck in a bit of a crunch. And physical therapy needs to unravel the hips, the spine, to teach the pelvic floor to relax. And there are some women that are just wound up very tightly anyways, and so they really grip and squeeze their butt and don't even know that they're holding all this internal stress, and it's in their pelvic floor. And it can lead to pain with sex, pain just sitting around. It can lead to urgency frequency. Back pain is related to pelvic floor discomfort, as are hips. It can lead to bladder pain. So this is something that your average OBGYN is not as well educated about, nor is a urologist. This is where someone like myself, a urogynecologist, ends up sort of after someone's seen 5 doctors going, you have pelvic floor pain. It's high muscles, high tone muscle. We need to address the muscle. So just something to be aware of. You'll know more just by having heard that term. Oh, what is that? It's like having TMJ, you know, what you get in your jaw, in your pelvis. It's tight, it's clamped down. And it can be as a result of weakness. It can be a result of the hips are off. It can be a result of back pain, trauma, all of those things. And this is a good book, Healing Pelvic Pain by Amy Stein, or When Sex Hurts by Andrew Goldstein. This is a list of intimate health lubricants, and I listed everything here, and I actually probably need to update this, but coconut oil and Woo Love, some of my favorites. And then there are some things that you can't really use it, like with condoms. You don't want to use an oil-based lube. Silicone, not natural, but only one ingredient, and it never dries up. If you do a water-based, if it dries up and gets sticky, you just need a spray bottle, and you just need to reactivate it, which kind of sounds funny and silly, but it actually works. And then there are some aloe-based, which are a little bit more slippery than water-based, but they still dry up pretty quickly, and they can get sticky. Here's some intimate wellness resources, several books. There's some videos, some websites, some fun intimate tips about how to keep things sort of interesting for the next many years as you go forth as being both parents and lovers. And so as we move forward, just know that it is all possible, that you remember that picture, and then there's this picture, and these are my sons. That's Nico, that's Luke, and that is Maxim, my child with autism, who started 7th grade this week, which is a trip.